I suppose some of the common problems is really around the logistics, setting up a testing area on site, any changes or introductions of policies and procedures to support the COVID testing. Again, depending on who's administering the testing, businesses may need to consider training and support and documentation. There's, of course, then looking at the type of testing kits and the supply of those kits. And then dealing with cases, so positive cases that will inevitably come out from doing the testing. So you can understand why it can feel quite overwhelming for businesses that have identified that they want to do testing and they want to take that responsibility, but sometimes just really not sure exactly where to start. There's so much conflicting information out there. So I suppose it's great, obviously, businesses like us that can really support and advise clients on what's best for them and their particular business. It's not just providing the actual testing itself. It is everything that sits around that, and every organisation is different in their own way. So it's just, I suppose, organisations having that point of contact that they can speak to and get advice, get support. Obviously, we keep our clients up to date on any significant changes. We hold regular webinars as well, which are really informative. I know we did one this week specifically on long COVID. So that was really, really well received. So as you say, it's just providing as much guidance and information to clients as we possibly can. Okay, as the UK is starting to open up as part of the government's roadmap, obviously we're all going back out socialising. There's really big gatherings now, these sports settings, gigs, concerts, etc. And of course, what we're seeing at the moment is an increase in positive cases, and unfortunately, we are starting to see the death toll climb as well. And I think we're kind of in that sort of uncertain time because we're just not quite sure what's around the corner, what the winter will bring for us. I think we're being prepared that we are going to have high cases and unfortunately high death rates again as we enter that winter period. So I suppose for businesses it's just trying to get that balance, isn't it, about returning people back to the workplace, getting their operations sort of running again, and testing really goes hand in hand with a lot of their other workplace practices that have been introduced over the last 18 months. And I suppose because testing in the workplace isn't intended to be where you go if you think you've got COVID, people are just attending work and could just be completely unaware that they've got the virus, and passing that on to their colleagues in the setting at work. So that's really the purpose of testing in the workplace. It's just that preventative measure, the proactive approach from the clients, and it just gives that level of reassurance to the staff as well that is happening. I think some people now think if they have been double vaccinated that they're almost sort of like immune to COVID, and it's unfortunately not the case. The vaccination programme without a doubt has been so successful and has definitely paved the way for the restrictions that we're seeing being lifted at the moment. But of course, no vaccine is 100% effective. We expect the virus will continue to mutate and change. So I don't think it's sensible for people to just think, well, that's it now, it's over, it's out of our lives, because it's very much still around us, and it's still very much part of what we're going to have to contend with for a long time to come, I think. I mean, I would say that it's still important as individuals to do testing at home on a regular basis. I think the government are definitely encouraging the use of the lateral flow testing kits for proactive testing where people aren't displaying any symptoms. I think when you put that into a workplace setting perspective, then obviously what you haven't got is visibility of that testing, or of course the results that are coming off the back of the testing at home. So again, I suppose it's where businesses are just recognising the importance of them taking some responsibility as well, of managing COVID within their settings. And again, as more people are returning to work, and the number of people in the workplace settings will obviously increase. It's just another measure to keep on top of things, really. But I think the main reason really is just that kind of visibility, and the reassurance that you can give that you can see that people are being tested on a regular basis. And I think what's really important as well is that we still see at client sites where, we're picking up positive cases, and people are still surprised to see that we're picking up positive cases, which I know sounds a bit bizarre, but obviously that is the point of it. I think at the moment there's sort of two main methods of testing, which are antigen-based tests. So PCR, which is typically back to lab, and still seen as the gold standard for COVID testing. From a reliability point of view, typically would get a higher reliability rate, mainly carried out by a trained professional as well. Lateral flow testing kits, again, they're quick, they're easy. Reliability is pretty good, to be fair. I mean, if it's been administered correctly, I think when you start to drop down on the reliabilities where people aren't using them correctly, and obviously that will definitely lower the reliability. I think what's quite exciting as well is there's some developments around new methods of testing for COVID, which are less invasive and a little bit more, I suppose, comfortable to undertake. One such test is where we're expecting saliva to become an approved method for COVID testing as we enter sort of the autumn winter of this year. So we're definitely watching that with interest and just seeing how that develops, because personally, but also for our clients, we understand that will be a much more sort of favourable option if that does get approved, as we are expecting it to do. There's no definite timeframes there, but we are expecting sort of towards that sort of October, November time that it will become an approved method. But yeah, essentially it is a saliva-based test, an on-site test as well, so it will still give sort of an instant indication that we've become familiar with from the lateral flow testing kits, but just with the collection of saliva. So again, just a much easier and nicer test to undertake. But I think, again, it depends how much research you do into COVID testing. Obviously, we look into things, on a regular basis, but there's developments going on all over the place, and I expect things will continue to develop with COVID testing and the methods that we use, that will become sort of quicker and easier and less invasive. So it's quite interesting to see how quickly things can be developed as well. I think that's the other interesting thing that I've definitely found, is how quick things move on. I mean, travel testing in itself is a bit of a minefield, and I think because the red countries and the amber countries, they get reviewed on a regular basis. So if you've planned your holiday in advance, then just expect that changes are likely with what the expectations are. And I think it's just doing your research and knowing exactly what the requirements are for each country. Some countries have started to differ depending on if people have been vaccinated. Some countries are allowing people that have been vaccinated not to require testing, but some are still requiring tests to be completed. And then obviously there's the return back to the UK. So you can still do the test to release if you want to come out, if you had to quarantine and come out of quarantine early, and the day 2 and the day 8 testing. So travel testing. To be honest with us, we have been kind of more supporting organisations who have travel as part of their business, rather than sort of going into the open market with holiday passengers, because that is almost like a different kettle of fish altogether. But we've done actually a fair bit of travel testing, mainly supporting businesses. The change in the rules this week is very much welcome. So if you do get identified as a close contact by track and trace, if you've been fully vaccinated, then you don't automatically need to do the self-isolation. I think this is where businesses can have it quite tough, really, because it isn't a straight answer from a workplace setting as such, because I think organisations need to consider their own risk assessments, and just making sure that a review of those is still up to speed and up to date with the recent changes, and if anything else needs to be considered to make sure that they're still managing the risk within their businesses. Because obviously each sector and each industry is so different. So I would definitely say a review of risk assessments is really, really critical. Also, there's not many industries where they're sort of mandating the requirement for vaccinations. I think at the moment it's just certain sort of like healthcare organisations or industries. So again, there's that kind of question mark around, do organisations need to ask about people being vaccinated? Do they need to disclose that? What are you doing with that information, etc.? So obviously, some organisations may have like vaccination policies, so that could be something else that needs to be reviewed and refreshed. I think as well, it's communicating to the workforce, like with everything, and especially with COVID, because there's so much confusion. I think the more communication that you can do with your workforce, it just helps really with what you're trying to achieve. We provided testing services as business anyway, and my personal background is in alcohol and drug testing, so relationship with obviously the laboratories, and really, when everything sort of kicked off in sort of March last year, COVID testing hadn't really come into, a business plan or anything like that. It was just a requirement that started to come through from our clients asking if we could support. I suppose, they trust us, they know that we provide, the right level of support, etc. So we pivoted quite quickly, having to train all of our technicians. We've got over 100 technicians across the UK. We pivoted to train those guys that were really quick on PCR testing. We had to introduce new policies, procedures, testing protocols. Obviously, we had to look at PPE requirements. And we were sending these guys out in the early days when, it was a pretty scary place to be. One of our first clients was one of the sporting arenas, so they were testing all of their sports people, and I actually went down to support on that very first day, and it was quite scary actually, because nobody knew. It was so early, and nobody really knew what was going on, what to expect. Obviously, testing was really new, so yeah, pivoted really quickly, and then from there. Obviously it expanded quite quickly, supporting other organisations, and really we were being lent on, I suppose, from clients in terms of providing not just the testing but that whole level of advice, and what do we do in this situation, what do we do, what would you say, everything was changing so quick that we just had to make sure that we knew and we were up to speed, and we were giving accurate and honest advice to our clients. So yeah, last year was crazy. It was so mad, and then obviously coming into the end of last year into the beginning of this year was the launch of the lateral flow testing. So just when we'd kind of established the PCR, lateral flow came knocking, and we had to sort of relook again at our testing methodology, looking at all of our protocols, the training, and again with the launch of the lateral flow, I think because it was a cheaper option, it opened the doors to a lot more organisations. It wasn't just kind of like the high profile sports people, and it wasn't just broadcasting. It was sort of a construction company or manufacturing company. So again, they needed a lot of hand holding through the process and getting everything in place and reassuring them and all the rest of it. And then I suppose on top of all of that, we had to go through a UCAS accreditation process as well. Which, as most of us will know, going through accreditations adds, a certain degree of stress. So yeah, I would say just in a lot of ways, it's been a challenge that has been good to be part of, and definitely, you feel like you are contributing in some way to the overall efforts of the country. And it has definitely been a team effort, even just from HK Medigold perspective. We've got guys that are going out and testing, daily, facing it head on, if you like. So yeah, it's been, I could talk about it all day, but it's been challenging but rewarding. So we've got a webpage which is hktesting.co.uk. So that's a specific site talking about COVID testing, our COVID testing services. Can also visit our main website, which is medigold-health.com, which talks about all of our services. But yeah, HK testing is specifically for COVID.